Hello, everyone. I'm Dr. Kritika Mohan. I'm a nephrologist and transplant physician in Bangalore, India. I'm also a part of the social media team of the Indian Society of Nephrology Southern Chapter that's scheduled to happen in Feb 2024. Today, I'm honored to interview Dr. Masami Nangaku, who is the professor and HOD of nephrology at the University of Tokyo Hospital. He's also the president of International Society of Nephrology. He's had several leadership roles in the Japanese Society of Nephrology, Asian Pacific Society of Nephrology. It's a pleasure to have you here today, sir. Starting off with the interview, could you please tell me what got you interested in the field of medicine and nephrology, sir?
Thank you, Kritika. There are many interesting and fascinating things in the field of nephrology. We have many patients, and the treatments are improving. Before, we had only RAS inhibitors to treat patients with kidney disease. But over the past decade, there have been many clinical trials, and there are many new drugs like SGLT2 inhibitors and HIF-PH inhibitors, which were developed based on the discovery of the Nobel Prize. So this field is advancing in a very fast speed. This is a wonderful field.
Also, thank you, sir. Also, I went through your CV, and you have about 350 original articles that have been published and about 100 review articles. So, what are your areas of interest in the field of nephrology, sir?
Thank you. My main interest in the field is oxygen biology in the kidney. Oxygen plays an important role to produce energy in the body, and loss or lack of oxygen supply induces a variety of damages in the organs, like ischemic heart disease, brain stroke, and progression of kidney disease. Patients with chronic kidney disease suffer from anemia with CKD, and that also reduces oxygen delivery to vital organs. As I said, we have a new treatment modality against anemia in kidney disease, which is called HIF-PH inhibitors. The three outstanding investigators revealed this novel pathway, which is called the HIF pathway, and they won the Nobel Prize based on these discoveries. In addition to oxygen biology, we do some researches about diabetic kidney disease, and we are also interested in telemedicine and telenephrology.
So, that's very interesting, sir. I mean, the lot of advances that have come in the last decade is really mind blowing. So, how do you use telemedicine and telenephrology, sir, in your practice?
Thank you. Actually, India has the biggest advance in telemedicine compared with Japan and other countries. India is a broad country with the huge number of population, and telemedicine is playing an important role. You had a lot of progress in this field. We are trying to apply telemedicine to our patients as well, and we are trying to develop novel techniques to improve telemedicine, because one of the problem in telemedicine is the lack of physiological data which we can obtain at home. So we are trying to develop new instruments to get the physiological parameters at home.
So, this is like remote monitoring of kidney diseases at home.
Exactly, and we are doing this in collaboration with the people from the Department of Engineering.
Okay, it's very interesting, sir. So, also, sir, you have a very interesting talk lined up in the ISN Southern chapter this year. So, you're talking about the oxygen biology in kidney. Could you give us a brief glimpse of your talk? What you would be covering in the talk? What aspects of this topic?
Thank you. I'm going to talk about the important role of oxygen in this world first, and then I'm going to talk about a role of chronic hypoxia in the kidney, which is an important mediator of progression of kidney disease. Then I'm going to talk about anemia in CKD, including how to treat anemia in CKD.
Lastly, sir, do you have any advice for younger nephrologists to set up their research and how to go about their practice in the future? Do you have any advice?
Thank you. Of course, young nephrologists are the future, and young nephrologists will serve and contribute a lot to the global kidney health. Asia is a very important region because more than half of the population in the world live in Asia. The economics in Asia are going up rapidly. So, especially, I'd like to encourage young nephrologists in India to make the global contribution to kidney health.
Thank you, sir. Also, have you been to India or is this your first visit?
No, I have been in India for a couple of times, and that's a wonderful country with a deep and fascinating culture. I love India.
So we look forward to having you in Hyderabad this year, sir. Thank you so much for your time. It's been a pleasure interviewing you. Thank you so
Thank
much.
you. And I also look forward to World Congress of Nephrology in India next year.
Thank you, sir.
Thank you.